I was really optimistic I was going to pass, and then I saw the result and I'm like, okay, I think I don't have it in me. So my confidence level was really, really, really low. My first exam, I was really, really anxious. I had to take some medications, but this time around, like, no need. Most of them said, no, I don't have anything in mind. But I've come to realize that at the end of this exam station, they have questions.
Imagine you work so hard only to find out that you didn't pass SCA, and you're so close but yet so far, failing by half a mark. Hi, my name is Dr Erwin Kwun. I have GP trainees pass the SCA exam. Today I've got a GP trainee who failed her exam by half a mark, but she knew that she had to do things differently to get different results. So she sought expert guidance. She passed her SCA exam with a score of 87.5. Let's get right into her case study. Hi Temi, could you please introduce yourself?
Hi, my name is Temi. I'm one of the C3s in Great Yarmouth VTS.
Congratulations on passing your exam. How does it feel?
Relieved, feel like a heavy burden has been taken off my shoulders. Yeah, it's a very good feeling.
Could you tell us, how did you first prepare for your SCA exam?
Well, my first SCA exam, it was just usual preparation with your colleagues at work and even your VTS colleagues, and just reading through cases. And yeah, I would think I was a little bit. I I was really. I thought I was detailed enough, and yeah, I thought, if looking back now, I can see some differences. But at that point, I thought I was detailed. I was ready enough, and to take on anything that comes with the exam. Yeah, but it was more colleague practicing with colleagues at work and the VTS. Yeah.
I see. So then, after that result of the first exam, I remember that you didn't have much confidence at the time. Could you tell us how did it feel after the first attempt?
It was terrible. I I failed by 0.5. But I was really optimistic I was going to pass, and then I saw the result and I'm like, okay, I think I don't have it in me. So my confidence level was really, really, really low, and I just had to pick up myself again and just try hard. I thought I did hard. I thought I practiced hard, but this time around I wanted to give it everything I had. So it took a lot, and yeah, it took really, really a lot.
After you picked yourself up, can you tell us how did you prepare for the second attempt, Temi?
Okay, so this time around, I knew what I was looking for. I knew for my data gathering, there are some things I shouldn't miss out. And for my interpersonal, there's some things I needed to say. And for my management, I knew that I needed to say some things beyond the usual. Like, if you know what the management is. So this is what I'm thinking. This is what we will do. This is what we'll do in the future. That kind of thing. Like, you talking in future terms, just not leaving things as they are, because I know I need to get the marks, and the management takes more marks than the other domain. So yeah, I had what I wanted in mind. So I just, yeah, it was more focused history taking, and just trying to get all your marks in the different domains. Yeah.
So, what are the misconception you might had in the first attempt that you had to break?
I wouldn't say I had any misconception per se, but I would say that I was more patient centered, not trying to get all my stuff out. And if I want to give you extra information, I will ask, would you like me to tell you what we'll do if things come out this way? And not try to, push everything. But I was more patient centered and not trying to get all my stuff out.
So, how did you structure your consultation, Temi?
Well, I had the tutorial with you, so the I had a number of sessions with you. So I just did everything we did at tutorials, and just the buckets, the bucket things, the data gathering and the PSO, everything. So that was what I did. Yeah, basically.
So you follow the structure we've got in the blueprint, as in the three buckets:
Yes.
so idea, concern, expectation, biomedical, and then psychosocial, situation, occupation. Going into the clinical management, were there anything in particular that you found really useful that you did?
I made sure that I finished my data gathering well enough time. I did struggle with some cases, especially the obstructive sleep apnea, but I made sure I finished early enough so I can get more time, because that carries a lot more mark. And yeah, that's what I did. Yeah.
How did you grow your confidence as you were preparing?
I would say with each sessions, my first session was rubbish. I felt really, but with each session, my confidence was building up. If you remember, you're asking me, so what's your confidence now? At the last session, my confidence around 6. So during the exam, after my first case, I'm like, oh, okay, I can actually do this. So as I moved on, I'm like, oh, not too bad. So I felt like, oh, you can do this, you can do this. So yeah, I would say my confidence was like 9 during the exam itself, but it was a gradual build up over my sessions. Yeah.
So one of the problems we had was the fact that you're getting very tense and anxious. When that happened, you were not able to perform well. So how did you manage that exam anxiety?
I was really anxious before the exam. I was, well, it was better this time around. My first exam, I was really, really anxious. I take some medications, but this time around, like, no need. Yeah, but this time I was able to manage my anxiety because I've been through this. So I knew the ropes, I knew what to do. So it was not too bad. But before the day, I was really scared I was going to fail this again. So, but during the exam itself, I knew that if you get really anxious, you're going to mess up, and then you start worrying about the next one, and you're not able to read and form your battle plan. So yeah, I managed my anxiety pretty well this time around.
That's great. So going into the 3 minutes reading time, how did you prime your case?
So for the very vague ones, for like a 16-year-old girl, 16 years old, I'm like, this could be mental health, it could be contraception. So I would just map out. So as soon as she starts talking, and I would just clean the ones that I don't want to use, then I'll just focus. So basically, I could tell from the for most of the cases, I could tell what they want me to do. But for the very vague ones, I'll start thinking, if it's this one, this is what you would say, and just try and write some things down very quickly.
So it sounds like you were anticipating already, looking at the
Yeah.
information. So that's really good way of doing it. Are you feeling unsure about the SCA? Maybe you don't know what to do, or you don't know whether you're doing the right thing. If you'd like to get a free copy of the SCA Blueprint, click the link down in the description below to get access to the SCA Blueprint that GB trainees have already used and passed the SCA exam. It's completely free. Just click the link down in the description below to get access to it. When it came to the uncertainty, what were the things that you found were helpful to manage uncertainty?
For the uncertainty, which I think might be due to the actor's error, she gave me the wrong scripts, and we were not going anywhere. So I had to tell her, "Can we come in? We have to come in to see you because I can't just wave your symptoms away, but there's something wrong with you." So there was one very uncertainties related station where I asked her to come in straight away today so I can examine you. So just to make us make patients for patient safety and also for my safety.
Yeah, so one of the things about this exam is some people might feel like they need to have a perfect consultation, but examiners are not looking for perfection. What they're looking for is somebody who can practice as an independent GP safely. So tell us about in your practice, were there anything in particular that helped you to boost your score this time around?
Well, in my practice, once a patient comes in and I see on the screen this is what patient is coming with, like menopause symptoms, and then I start rehearsing. We all know that the real life case is not the same as the exam cases. These patients are primed and they know what to say. But then I try to get myself in the exam condition, but sometimes doesn't work because patient just goes goes off, but I have to bring her back. So I try to, in cases that are very exam-like cases, I try to act out exam scenario and just practice like I would ask during the exam. But it's really not that easy for me.
Yeah, there are some differences. For example, in real life, if you ask a patient what symptoms did you have, they most likely will tell you. But in the exam, the simulator is going to ask you, what do you mean, or such as, because they're not allowed to tell you, because the exam is assessing whether you know how to ask, elicit the right questions. And then another thing is exploring ideas concerning expectation. What were the way that you were exploring patients' health agenda?
So I first golden minutes they just talk, and then I just late, just at the end or some seconds later, then ask them, is there anything you have in mind? Most of them say, no, I don't have anything in mind. But I've come to realize that at the end of this exam station, then they have questions. These are questions you have to answer because these questions carries marks. So I realized that quite early. So I tried to, finish up, and I know she's gonna have questions. He or she's gonna have some questions, and I answer the questions. But I find a way of getting my eyes in there, and then I go straight to because it helps me even with my data gathering. If you think you've got migraine or you've got something serious, then I ask questions to rule out the serious things. Then I'm able to use that in my management to reassure you that from what you've described, doesn't sound like this, but this is what I'm thinking. Yeah.
Yeah, so there's usually a twist in the consultation, and it's important to be able to readdress that. So tell us about on the day that you went through the exam, as in, were there things that you felt maybe you were going to fail, or how did it go?
Yeah, there was a station I thought I didn't do well, but I passed. So I know we've had seminars that tell us that the cases that you think you do really bad, you might just pass them. Don't worry about them. I was really, really worried about this case because I know that once you start failing a case in the three domains, it's not a good sign. It's not a good sign. So try as much as possible and just don't fail all domains in a case. So I was really worried I was going to, but funny enough, I did pass well.
So from the first attempt, you passed with a good score compared to where you failed it by half a mark. Tell us, what was your result?
87.5, I can't remember. I think 87.5.
87.5. We'll have it on the screen so that people can see and the breakdown. When you saw the result, how did you feel then?
I actually wanted to check if I passed or not. So when I just saw passed, so I'm like, good. Then I just went in. I was like, okay, not too bad. So it was it was a good feeling. It was way far beyond what I did my first attempt. Yeah, it was good. Yeah, I was pleased with that.
Yeah, I mean, that's quite a big jump from failing it to actually getting over 80s. Tell us about if you had to go back and resit the exam, were there if like few things that you would have done differently so that you don't waste time and energy?
Yes, there was a case that I thought I would do really well, and I sort of, for one reason or the other, I just mumbled everything up. But what I've learned now is take it take it step by step, because I had the knowledge, and I was just trying to put everything out at once. But yeah, just step by step. That would, yeah. But because it's not enough that you have the knowledge, they want to test how you communicate this to the patient. So yeah, that particular station, if I had done very well, I'm sure the outcome would have been better. But yeah, just take it step by step and just give it to the patient. Yeah.
It's important that people try and improve 1%. Slow progression is better than trying to learn a lot and try and do much when it's really overwhelming. What you want to do is to get to a level where on the day of the exam, it feels almost like it's internalized when you're able to consult naturally. In terms of the preparation, all in all, then how long did you take to prepare for the second time?
Second time was for March, April, 2 months. No, two and a half, roughly 2 months. Yeah, the second time was roughly 2 months.
Were you doing recordings as well?
Yes. I didn't like it, but I did it, and I was able to see what I did wrong, and that was when I learned that sometimes, because I'm thinking of what the patient is telling me, then I'm not actively listening, and I miss some cues. So that too helped me. So yeah, I did a number of recordings. Yeah.
Yeah, so watching back the recording is not something trainees like. However, it's so valuable because then you can pick up cues and can see, oh, that's why a patient asked this question later because I didn't pick up on that cue. So it's really good to see that you've managed to pass your exam and you're due to CCT in August, I understand. What's your plan afterwards, Temi?
Definitely salaried post, but I'm taking some time off, maybe a month, because it's been very, very tough. Yeah, but definitely salaried post. Yeah.
Great. Yeah, so thank you very much for listening to Temi's story today. If you find it useful, please leave a comment down below to actually say what was the one takeaway that you've got from this video. And if you found this video useful, you might want to watch the next video here. Take care, everybody. Bye-bye.